The Iowa Cancer Report shows there could be almost 3,000 Iowans diagnosed with breast cancer this year. And a MercyOne event this weekend is hoping to get more mammograms for more women. So we're joined now by Dr. Tiffany Torstensen, a breast surgeon, and Dr. Sandra Ruse. She's a radiology physician. Doctors, thanks for joining us this afternoon.
Thank you for hosting.
Hey, let's talk about an event that you have coming up. It's very important when we're talking about prevention, early detection. When we talk about the importance of mammograms, it's really hard to not underline that and underscore that enough.
Yes, mammograms are covered by insurance, but there are many women who are underinsured or uninsured, and this offers a spot for them to come in and get screened for that early detection.
So let's talk about the event. We're talking about muffins and mammograms. Mammograms and muffins, whichever one comes first, you get both of the M's together. What is this event?
It's an event that is at 3 different locations for MercyOne, and we have muffins and coffees and juice available while you're waiting to get your mammogram. It's a simple procedure to come in, change into a gown, get your mammogram, and then be walking out, usually within a very short amount of time.
We were talking just a little bit before this segment, Dr. T, and you were saying that as a surgeon, it's really difficult to know that there's a lot of outcomes that could be different with a mammogram, with early detection. Can you explain that?
Yeah, breast cancer is staged like any other cancers. There's 4 stages with each cancer. Obviously, 1, 2 are better stages than 3 and 4. And so I always tell my patients mammograms can't prevent cancer, we can only detect it. And we really want to detect those patients at a stage 0 or like a stage 1 cancer. Why? Because 1, lots of times we can, do breast preservation where they don't have to lose their breasts, and also sometimes the adjuvant therapies, speaking of like radiation and chemotherapy, can be avoided in these early stage breast cancers.
Are you seeing more cases that are more late in the, not the 0 or the 1 that you were just saying that you hope for whenever you know that you have a patient?
Yeah, I think COVID, Dr. Ruse and I were talking about that. I think lots of people kind of delayed some of their screening mammograms, some healthcare facilities, we weren't seeing as many patients. So for a while there, I think we were seeing a little more patients coming in with more palpable masses and stuff, and those usually mean later stages.
But as far as the outcomes, obviously with anything, you're making strides on the surgical side, just on the treatment side. There's just so much going on still with breast cancer that the outcomes have to be better.
Yeah, so getting a stage 1 breast cancer, it's over a 95% survival over a 5-year period, and I think, even with surgery, it's becoming less and less, because we have more adjuvant therapies, we have, more medication that people can take, and we're lessening our treatments, but I think it's kind of a multidisciplinary approach that we have all the medical oncology, radiation oncology, and surgical oncology side, so I think we're getting better outcomes because we're getting better treatments.
And Dr. Ruse, you were saying just kind of the standard now in mammograms is this 3D imaging?
Yes, it has evolved from a regular film screen, and we went digital many, many years ago. And 3D allows us to kind of page through the entire breast, more like a book, so that we can actually find more subtle findings. And 3D is almost a standard of care among imaging.
So these women that go to this event over the weekend, you will be reading then their imaging the following week?
Correct. Screening mammogram is not directly or isn't often directly interpreted. It's acquired, and then they're read usually that day, or if it's a weekend, the next work day, and we'll follow through with getting the reports to the patients after that.
Just to underscore the need, this event, people have signed up. There's no spaces left, but I imagine this will not be the only time that these events will help reach more women in our community.
Correct. And we do have spaces available for those people that do have insurance coverage throughout the regular week, but this is a one-day event for those underinsured or uninsured women.
Okay, well, very important. Muffins and mammograms. The information is on your screen this Saturday from 8 to 12. You mentioned those locations where people could go to. The number's on your screen as well for more information. Doctors, I appreciate you joining us to talk about all the good work that you're doing and let people know about this upcoming event.
Thanks for having us.
Thank you for hosting.